For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.
Hi, everyone. Thank you for being here today. We are here with Dr. Sara Cody, the Public Health Officer for the County of Santa Clara. She is here to address the updated metrics with regards to indoor masking for the county. Before we get going, just a few minor details. We will take questions in English as soon as we are done with her initial presentation. And after that, we will have speakers in multiple languages. And without any further delay, we will go right to Dr. Cody.
Good morning, everybody. Happy March. So this is going to be a pretty short press conference. Really, I'm here today to confirm that in Santa Clara County, we've met all the metrics that we set out as we anticipated that we would. And as of tomorrow, we will move from a mask requirement to a mask recommendation. So just shy of 85% of our entire population is vaccinated, 84.8 to be exact. And over 1 million county residents have now received a booster. So just shy of 70% of those eligible in our county have been boosted. The number of COVID patients in our hospitals continues to decline, and our 7-day moving average of new cases per day is at around 350, so well below the 550 metric that we had set. And importantly, it continues to decrease. So as of tomorrow, March 2nd, our masking requirement will transition to a strong recommendation for indoor masking, as it is across the state. So this is good news, and it's especially good news that the level of community transmission in our county continues to decline. But as much as we wish it were not true, we are still in the middle of a global pandemic, and we still do have community transmission of COVID, and it still is an airborne respiratory disease. Those things are all still true. And the lower the level of community transmission that we have, the safer it is for all of us. And we also know that as inconvenient as it may be, COVID is not inconsequential for many of us. For many of us, we still do continue to be at risk of death or severe disease. And for many, many of us, we are at risk of long COVID if infected. And there's a lot that we still don't know about long COVID, which is why I want to say that preventing infection is still a worthy goal. And we know that masks are effective at preventing infection. They are still a very important layer of protection for an airborne viral respiratory disease. So for each of us individually, it is still important to wear a mask when indoors. And for all of us as a community, it is still important that we all wear a mask indoors. And that's to protect each other and to honor our value of equity, which is that we protect those in our community who are most vulnerable, young children who are not yet eligible to be vaccinated, people who are immunocompromised or who have other health conditions, or anyone who may have been vaccinated but still isn't getting adequate protection from the vaccine. For those, it is still important that all of us continue to mask indoors. So with that, I am happy to take questions.
We'll start with Carolyn. Telemundo.
Yeah, I would like to know about school districts. Can they make decisions when it comes to masks?
The state announced yesterday that at the end of the day on March 11th, they will be changing their requirements for K through 12s, and their guidance will recommend masking for individuals but no longer require it. In Santa Clara County, we have not had county level requirements for schools in well over a year and a half. So we don't have any at this time, haven't for a long time, and won't be adopting any. So the schools will follow the state guidelines.
KPIX?
Dr. Cody, so the mask mandate lifts tomorrow, but at the same time, you're telling people to continue wearing masks indoors. Can you speak about what looks like on its face, looks like a conflicting message?
So what we said here in Santa Clara County was that we would continue to follow our metrics, which we have, and that we would not transition from a requirement to a recommendation unless we meet those metrics. We have met the metrics. We are transitioning from a requirement to a strong recommendation. It's a balance, right? At some point, we do need to transition from a requirement to a recommendation. In our county, we set metrics for when we thought that was safe enough. So it's not completely safe. As I said, we still have community transmission of COVID, but we've reached a level where it feels safe enough to make the transition from requirement to strong recommendation. And that's the transition that we'll be making as of tomorrow, March 2nd.
Clarification question for the indoor mask mandate, that drops for both vaccinated and unvaccinated. And the second part to the question, could businesses in Santa Clara County still choose to require masks?
So it's a two-part question around does the the change in masking apply to everyone regardless of vaccination status, and can a business still require or recommend masking? So yes, as of yesterday, the state announced that the state had a requirement that those who are unvaccinated still were required to mask indoors, and they lifted that yesterday. So as of tomorrow, we will essentially be aligned with the state, which is a strong recommendation for everyone, regardless of vaccination status, to continue to mask in indoor public settings. Now, an individual business can certainly require patrons to mask. They can certainly require employees to mask, and we would certainly support that.
Additional follow-up questions? Go ahead.
What would it take to make everything go backwards? With obviously good weather's coming up, summer's coming up, vacations. You guys have amusement parks here. What would happen in order to make you have to go back on this?
So the question is, what would it take to go back? So first I want to say that our trends are very strongly in a downward direction. So as I mentioned, the levels of community transmission have declined significantly over the last week and very significantly over the last 2 weeks. And the rate of decline continues to be fairly steep. So that is very good news for all of us. I also want to say that our wastewater surveillance, which we follow very carefully, still looks very encouraging. Those levels are quite low. So all of our data are consistent that the level of community transmission in Santa Clara County is continuing to decrease. We also know that outdoors has always been safer than indoors because we have natural ventilation. And so outdoors, I'm not wearing a mask today. I feel completely comfortable that you all are protected. I'm at a distance from you and I'm not wearing a mask. And with our fantastic weather here, a lot more activity will be happening outdoors, and that will be really good. What we can expect with this pandemic is that we will have peaks and valleys. So right now we're coming into a lovely valley. We can all really enjoy that. However, we probably will have another peak. The contours of that peak are not known to us. We don't know what the variant will be. We don't know how the variant will behave. So we always have to be ready. And that means having adequate testing, being ready to wear, high quality masks more often, and being ready to distance from one another and have smaller gatherings or whatever it is that we need to do, we'll be ready. Right now, what we're saying is the risk in our county is decreasing. That is good news, but there are still many who are at risk. Long COVID is still unknown. it still makes sense to prevent infection however we can. We know that masks work, and we strongly recommend that everyone continue to wear them in indoor public settings.
Final question? Yes.
Does the vaccine still recommend mandate?
We still recommend vaccination and booster. There is no community-wide mandate for vaccination and boosting. We have a booster mandate for very specific settings, high-risk settings, the workers in those high-risk settings. There is no vaccination mandate that's broad in Santa Clara County.
For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.